Good morning, all. Am I audible? Great. Good morning. We are starting our reading club with the prayer.
हमको मन की शक्ति देना, मन विजय करे, दूसरों की जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, मन विजय करे, दूसरों की जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जैसे पहले खुद को जय करे। हमको मन की शक्ति देना।
Good morning, all. We are giving tribute to our great master, Dr. Samuel Hahnemann, for wonderful divine science to all of us. Taught us dare to be wise, seeking blessings from our Guru, Dr. Prafull Vijayakar, who have bridged this divine science with a modern science and made homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijayakaraaya Namah. Friends, we are learning the wisdom of Master Samuel Hahnemann from the Organon of Medicine 6th edition, as well as we are reading the Genetic Materia Medica by Dr. Prafull Vijayakar. So up till now in Organon of Medicines, we have covered the theoretical part up to 70 aphorisms, then the disease understanding, the miasmatic understanding, then the case taking part, then the medicinal part, and now we are reading and understanding the wisdom of Samuel Hahnemann, how to apply the medicinal knowledge to the patients or a disease. So in continuation of this, aphorism number 156. Even in aphorism number 155, what is Master Hanuman has told that when you apply the minute dose, then in acute condition, the must recovery must start in the first hour, and you will not get any of the symptoms of the medicinal power. Only the symptom similarity has taken care, and that symptom has to remove, and that is the law of simile. So, in further continuation is of this, however, there is almost no homeopathic medicine, be it ever so suitably chosen, that especially if it be should be given in an insufficient minute dose will not produce in very irritable and hospitable patient at least one trifling or unusual disturbances, some slight new symptom while its action lasts. For it is next to impossible that medicine and disease should cover one another symptomatically as exactly as two triangles with equal sides and equal angles. But this, in ordinary circumstances, unimportant difference will be easily done away by a potential activity energy of the living organism and is not perceptible by the patient, not excessively delicate. The restoration goes forward to the goal of perfect recovery if it be not prevented by the actions of heterogeneous medicinal influence upon the patient by the error of regimen or by excitement of the patient. So this is very important understanding that when you apply the homeopathic medicines, even the irritable or sensitive people will not produce any of the symptoms after applications of this medicine. If you apply this law of similar, that is but exactly the triangle with the equal sides of the equal angles of the disease and the medicinal symptoms, because the vital energy will take care of the another symptoms of the medicines. And finally, we will reach to the goal of perfect recovery. But he has mentioned that if we apply these medicines in a very minute dose, and if this is prevented or this is prevented by the actions of the heterogeneous medicinal influence, that means the allopathic medicines upon the patient, or by the error in the regimen, or by the excitement of the patient. That excitement of patients means there is some emotional disturbances which can hamper the actions of the medicine. So that is what Master Hahnemann was giving idea about it. And also he has shown in aphorism number 155 that our medicine will not produce any of the side effects in patients. But though it is certain that homeopathy selected remedy does, by the reason of its appropriateness and the minuteness of the dose, gently remove and annihilate the acute disease analog to it, without manifesting its other unhomeopathic symptoms. That is to say, without the production of the new serious disturbances, yet it usually immediately after injection for the first hour or for a few hours causes a kind of slight aggravations when the dose has not been sufficiently small, and which has so much resemblance to the original disease that it seems to the patient to be an aggravation of his own disease. But in reality, it is nothing more than an extremely similar medicinal disease, somewhat exceeding in strength and original affection. So here, Master Hahnemann has given an idea that when you apply the law of similia and applying the minuteness of the dose of a homeopathic appropriate remedy, it annihilates the acute disease without manifesting any of the symptoms. But when it is in a chronic condition, it produces a slight homeopathic aggravation. But that homeopathic aggravation of a medicinal symptom, it is not something like a different. It is something like the original natural disease. So, for example, what sir always says, Vijay sir, when you give a medicine to the child, when in acute condition of fever, initially the fever rose and then fever went down normally, and everything will be taken care by the vital force for our immune system. So this is what something Master Hahnemann is telling us. about the homeopathic aggravation. This slight homeopathic aggravations during the first hour a very good prognostic that acute disease will most probably yield to the first dose. So this is very important that homeopathic aggravation, that means the medicinal symptoms that produce in the acute condition. It is not of a different paradigm, but it is of the original disease has been slightly increase and then it reduce. So this is a good prognosis. So Master Hahnemann is telling about that in a follow-up case in acute conditions when you apply this law and you get a slight homeopathic aggravation in the first hour, then it is quite enough to understand that your medicine has acted and the later the disease of the acute character will be vanished soon. So, these slight homeopathic aggravations during the first hour are very good prognostic that acute disease will most probably end with the first dose is quite as it ought to be, as a medicinal disease must naturally be somewhat stronger than the malady to be cured if it is to overpower and extinguish the later that is acute disease. Just as the natural disease can remove and inhibit the other one similar to it only when it is stronger than the later. So this law of similia, which was given in aphorism number 43 to 48, where he has mentioned about when the stronger natural disease occur, the older one get repelled. In further aphorism number 159, what Master Hahnemann is the telling us that the smaller the dose of homeopathic remedy is in the treatment of the acute disease, so much the slighter and the shorter is the apparent increase of the disease during the first hour. So that is what very important understanding. What is the meaning of the dose in this? That the dose is count as the crude substance, or sometimes you can understand that whenever we are giving a law of potentization. That means the medicinal power has been increased, but the quantity of the dose has been reduced. So we are diluting the dose from the 30 to the 200 to the 1 m or a higher than the 10 m and 50 m. So in most of the acute cases, whenever you apply the higher potency with the minuteness of the doses, then there should not be aggravations happen at all. So this is what Master Hahnemann gives idea about this. So we will continue our journey on the understanding and the reading of our genetic materia medica. So in genetic materia medica, we have understood that we are dealing with the man and treating the man at the level of gene. So to understand the man, we have to understand his mental makeup, his physical makeup, his general makeup, and his disease makeup. So mental makeup gives rise to the extroverted, introverted, will, intellect, moral, attachment, sensitivity, whereas the physical makeup gives rise to the height, stature, postures, gestures, everything, and the general makeup gives rise to the desire, aversion, thermal thirst, and everything. And the disease makeup, which gives rise to a process that the disease has been developed in the three process, and that three process which is reflected at the cellular level, at the pathological level, we consider it as the miasmatic process, and that is why we are reading the tri-miasmatic medica of the Dr. Prafull Vijayakar, the genetic materia medica. So up till now we have read about the Baryta group, and the basic concept of the Baryta is the understanding of the Baryta mental picture is the misplaced things. So the priority is not set anywhere, and that is what the misplacedness is. So we have understood the mental makeup and the physical makeup of the Baryta. Now we are understanding the disease makeup of the Baryta, how the Baryta medicines act at the disease level, and which miasm has been produced, so that we can understood that person comes to us in particular miasmatic reflections, and that reflection is produced, and that we have to take care of. So the genetic miasmatic reflections in the Barytas. So Baryta is a purely a psychosis remedy. So in that, the predominantly use the psychosis miasm for the defense. Now, as we have known about the end of miasms, the miasms of miasm book, in that the psychosis is represented into two categories, that is psychosis excess and psychosis less. So the Baryta can be there in both. So we have to understand that. In psychosis defense, also predominant aspect is the hypopsychosis and psychosis less. For more understanding, you need to read the book End of My Assumptions of My Assumptions by Dr. Prafull Vijayakar. The main feature is the shallowness or the shortness of everything. That is what psychosis is. Suric miasm is rarely seen in the Baryta except in a few physical aspects like the inflammations of the tonsils, etc. So Baryta hardly causes any inflammations for the prolonged time. Baryta physically cause induration, thickening by increased synthesis of fibrin or the laxity from the less synthesis of the elastin. So this is what you have to understand at the genetic level. In the last phase of the man, the Baryta may show some destructive element as in case of senile dementia. Generally, there is no destruction in the Baryta, no destructions of the intellect or the organs. This means that the most important things we see in Baryta is not inflammatory disease, not destructive disease, not fast disease, because we know that Baryta is always a slow remedy, but only slow moving chronic affections, and that too of elastin less or fibrin excess. So that is what you have to understood by understanding the book End of My Assumptions of My Assumptions. The psychosis less at the physical level causes the shortness of the process or the arrest of the process or the growth has been arrested. The shortage of the growth hormone causes the arrest development of the mind and body. Here you never find the destructions of the intellect or the sanity. Therefore, except Baryta, we never find Baryta being indicated in any of the insanity or schizophrenia, where essentially the mental faculty are out of control paroxysmal. So very important when you are treating the patient of insanity and schizophrenia, ruled out Baryta except Baryta mute because Baryta mute may can go into insanity. Baryta will not have any destructive tendency, no suicidal thoughts, no insanity, no schizophrenia, no mania except dipsomania and the mania to work, which are more out of the habit and passion. At physical level, the destruction is also seen in also skin deep, that is ulcer on the skin. So this is what the Baryta is. The destructive tendency is seen only in Baryta mute. The Baryta mute has psychosis excess leading to the excess depositions of the fibrin. This reduces elasticity and makes the artery brittle. Thus, the Baryta mute is only Baryta that goes out of control, causing destructions of the control of the behavior, giving rise to insanity. Now, shortness everywhere, we can find out the shortness of the concentration, absent-minded, concentration difficult, confusion, the shortness of comprehension, the dullness, the short intelligence giving rise to a childishness, foolishness, confiding, indiscretion. Short confidence gives rise to timid, cowardice, embarrassment, confident want for self, clinging to mothers, high desire to irresolution. Shortness of understanding gives rise to comprehension, difficult delusion, mocked at, laughed at, dullness. Shortness of the memory gives rise to forgetfulness, dementia, memory weak for the names, for what he was about to do. Shortness of the development giving rise to mental development arrested. Shortness of the courage gives rise to frighten easily. Shortness of the discretions gives rise to indiscretions. Imbecility, idiocy, laughing childishly, laughing immoderately, laughing at agreement, shortness of the mental flexibility gives rise to fixed idea, and shortness of the speed gives rise to slowness. So these are the few indications that you can understand that everything is short. Here we can never just memory weak and prescribe Baryta carb or old age dementia and give Baryta carb. We need to confirm whether he is holistically a Baryta. So today's picture of Baryta carb holistically covers the childishness, chilly, thirsty, right-sided with misplacedness everywhere. But we have to see whether he was a Baryta in childhood as well, or else the dementia will not be cured. Thus, while prescribing the above symptoms, the rubrics are just pointer to the remedy and care should be taken by the physician to confirm whether the patient concerned is Baryta or not. So to confirm the Baryta, sir has given the basic idea about the entry point of the Baryta in short. So how Baryta represent and how we have to take into entry point of the Baryta in our cases. So we have to understand man from the physically, generally, and mentally. So physically, when we see the people who are not grown to normal height or the stature, so we have a short stature or a dwarf people, we can think of the Baryta. Those who bald early by 20 or 25 years of the age and show a receding hairline from the frontal region, that is also a Baryta. Rounded features, the knobby nose, occasionally a mixture of the rounded and the squarish face. Again, this is a physiognomy you can think of Baryta. Generally, it is the right-sided, chilly, and thirsty. Mentally, when we see a timid, bashful people or a children, a grown-up who came with the parents and the spouse who does more of the talking because they are not confident of themselves. So whenever you find that any people comes to your clinic and they are very bashful and timid, or so this is what you can think of Baryta. So grown-up people comes to with the parents or the spouse and who does more of the talking because they are not confident of themselves. So the spouse and the mother is giving history, not that person. So that is what the Baryta you can think of. People who talk too much or show overconfidence, but it sounds foolish. So this is what also you can think of Baryta. There is one remedy like Paris quadrifolia having the same phenomena that Paris quadrifolia is self-satisfied loquacity. He is also a foolish kind of personality and talking foolishly in the clinic with overconfidence. So you can think of Paris quadrifolia when you are thinking of Baryta also. So people who do not understand the physician questions at one stroke and give thoroughly confused or a wrong answer, so you can directly assess that his intellect is not so up to mark and it is dull intellect remedy. When any amount of the instructions or the explanations the physician gives is a waste, then you can think of he is not understanding and he might be a Baryta constitution. The patient who repeat the same mistake again and again, that is also the Baryta. The people who do not understand the importance of the important things, then also you can think it is Baryta. Because the priority has in your mind is not there to understand the gravity of the situations and they give you priority to unimportant things. So this is what you can think of Baryta. People who are inattentive, unobservant, with weak memory, you can think of Baryta. People who have a fixed job for a long years, many years, you can think of the Baryta. People who are fixed in their routines and do not have adaptability to the change, then also you can think of the Baryta. This gives rise to a rubric of routinism or routinistic. People who cannot use modern gadgets because they cannot understand anything new and hence have no confidence to do so, then also you can think of Baryta. People who have no creativity, people who have everything misplaced, that means misplaced understanding of seriousness, misplaced of attachment, misplaced of affections, misplaced of obstinacy, misplaced in actions, opinion, and the behavior not related according to the age. then you can think of the right. There is a slowness of everything, so it is a slowness of development, slowness of growth or retarded growth. There is a dwarfish or retarded growth, slow in understanding and reacting, slow in the progress of disease also. So the Baryta will suffer most of the psycho or psychosomatic disorders, not to progressing fast. So there is a slow, indolent, and non-healing ulcers. So, in short, Baryta is chilly, thirsty, slow, misplaced, and right-sided. So, these are the few characteristic symptoms you can think of a Baryta along with the mental pictures. Now we have to understood this is what the Baryta Ka pictures. But when we are understanding that he might be a Baryta constitutions, we have to differentiate it from the other Baryta sort, that is Baryta Phos, Baryta Sulf, Baryta Carb, or Baryta Iode. So all these salts have their own peculiarity in the drug proving along with a lot of feature common to that of the Baryta element. So once the Baryta element has been identified, the salt can be zeroed in by use of the individual peculiarities of the salt coupled with the thermal and thirst. So in this, the filter of thermal and thirst has to be applied. So Baryta phosphoricum. Now we all know the phosphorus having a need for the love and care and affection. So what could be the Baryta phosphorus combination? So the chili thirsty Baryta with a misplaced want of magnetism and affections and the love. So something which is misplaced at the level of love, you can think of the Baryta phosphorus. So this picture of Baryta Falls is not from any proving and the information, if any, is not available. In absence of such picture, the combining of the Baryta Ka picture with the phosphorus picture has shown the excellent result. So Dr. Jeremy Sher has used the prescription, synthetic prescriptions in his book Minerals and Homeopathy. He taught us about the minerals theme of the particular salt and also the theme of a different salt. So when we combine these salts and he made a thematic representations of this. So this is what Dr. Vijayakar also understand that when we are thinking about that, we have few symptoms of the Baryta and a few pictures of phosphorus are shown in the patients, you can directly think of experimentally the drug picture of Baryta phosphorus. Now, phosphorus is known to give love and take love. The love of Baryta phosphorus knows no bounds. The affectionate nature of the phosphorus is misplaced or even distorted, but not perverted. So, very important, there is no destruction, so no perversion there in the Baryta phosphorus. The love exhibited is uninhibited. The desire for magnetism and touch can be from anyone, even from the unknown person. The patient can seek to hold the hand of the doctor, nurse, and attendants, and also people whom she has not met or known before, whether of the same or the opposite sex. The clinging to parents or to the children is marked, and when there is a conflict that arises with the children, the lady goes into depressions and become an easy victim of the cancer, and that too of a left breast. So this is what the Baryta misplaced love is. So sir has given one of the case example and treated beautifully. So the case of the lady with the left-sided breast cancer can give a clear idea of the misplaced love and affection. This lady was always found in the hospital, not admitted as a patient, but doing favor for the patients who were admitted most of the time. She was not doing it for the relatives but acquaintance. She would sacrifice her home, work, and money and stay in the hospital day and night, not because she was sympathetic, but so that it would earn her a good name. If someone asked her for the help, she would go out of her way to help them, even if it is mean inconvenient to herself and her family. The priority were entirely wrong. So this is something that affection has entire priority of affection has entirely wrong, giving rise to pictures of Baryta. There is over sympathetic and having the disease of the left breast cancer. Note, the Baryta phos has the sharp features like the phosphorus. Phosphorus is extroverted, it is extroverted like the phosphorus. It loves cold drinks like the phosphorus, and it is fearful of dark like the phosphorus, and desire magnetism like phosphorus. And again, it is a bleeder like the phosphorus. So this is what Baryta phos can be like this. Another case what sir has shown us in this book, the lady of 55 years age with the look of only 30 years came with the complaint of the menorrhagia and the rheumatism. Her menstrual flow was very profuse, bright red with many clots. She was short with a sharp feature. She was chilly and thirsty. Her behavior was sweet and very childlike. She was loving and affectionate. Her ability to use regular gadgets or even remote control of the TV left much to be desired. She was known for making gifts to all, but a very strange thing was that she would make gifts to new acquaintances and forget her near and dear ones. She was very good in making new friends, but never maintained her relationship, not even with her own sister and her brother. But she was mild, timid, and never quarreled with anybody. So sweet and small looking, the symptoms goes toward the Baryta, could not use remote control of the televisions and new electrical gadgets give rise to the indications of Baryta. She looks very young as if she was 30 years at the age of 50. She can Baryta indications of it. She did not have the right priority, would make gift to the strangers and acquaintances, but conveniently distance herself from own relatives. It is again the misplaced priority in the relationship. The Baryta, there is a profuse bleeding of the bright red blood. The indication gives rise to a phosphorus, loving and affectionate. Indication gives rise to phosphorus. So, on the basis of this evolution or analysis of these symptoms, giving rise to the combined pictures of the Baryta and phosphorus. So, Baryta was 201 and it stopped her menorrhagia and cured her rheumatic arthritis. She gradually went into very normal menopause without trouble. So this is what when you find any of the symptoms, this is another way of analyzing the case and you can apply this analysis in your practice. The another source of the Baryta, so Baryta mure. So the Baryta mure can be hot. So whenever the muriaticum, iodum, and the chloratum has been added as a salt, you can think of it is a hot remedy. Sometimes chlor can be chilly also, but most of time the iodum, muriaticums are the hot remedy. So the hot Baryta plus the thirsty and the slow. As we all know, the muriaticum theme gives rise to the introvertedness, gives rise to the motherly natures. So the whenever we find the muriaticum, the introverted Baryta, hot Baryta, and thirsty and slow Baryta, you can think of the Baryta. So we can start thinking of Baryta. So this is what the analysis happening in our mind when the patient comes in front of you and patient is sitting in front of you. So we can start thinking of Baryta mood when we see all the features of the Baryta calf, but the patient is hot, thirsty, has a sharp features, thin neck indicating sensitivity. It is introverted and not an extroverted like Baryta calf. So this is what we have seen. The Baryta Kav is extroverted, Baryta Fos can be extroverted, Baryta Sulf can be extroverted, but Baryta Moor is introverted. Psychotic Baryta Moor may be having rounded nose and receding hairline with the frontal baldness. So Baryta Moor found very commonly in the Orthodox society of the rural India where a lady is confined to the routine kitchen work. Her whole life revolves around her family, her kitchen, and her recipe. The Netramure housewife Can also be introverted with the responsibility of the house and the family, but she is an intellectual, always ready to take an extra work and responsibility that does not necessarily belong to the routine. If left to herself, she can quietly and efficiently accomplish work in the bank or get a loan passed for the running or a business or even be interested in the discussions on the political matter or a spiritual matter which interests her too. So this is what Netram Mute understanding. And now the Baryta Mute. So Baryta Mute lady can never do all this. Her brain does not allow her to think outside her routine. She performs like a machine or like a bullock in the olden days who used to go round and round the well to draw water from it for the days on end. She can never ever discuss philosophy or politics. So this is what the slight difference between the Netra Muse and the Baraita Muse. Whenever I used to learn this Netra Muse, what Netra Muse is, Dr. J. Patel sir, a senior most homeopath from the Gujarat and the guide of the PG student and a PhD student, who taught us that Netramur in one word is Gujarati, that it is something like Netramur personality is like a agarbatti. That means the incense stick. So incense stick, when it is burnt, it gives a fragrance to everyone. So that is what the Netramur personality is. Burning himself for the betterment of the other so that nobody can hurt and she also cannot be hurt. So this is what the Netramur personality is. But Baraita Mu does not have the intellect and does not perform everything in a rather than routine. She can perform best, but outside the routine she cannot. So that is what the Baraita. Even Kelkeria lady might look after her household well. She is also a person who goes on performing her routine task at home. She never ventures to discuss politics, nor does she venture on her own to do some unknown task in a bank. A soft Calcaria can never handle any official work, but the Calcaria and Baraita differ in many ways, though both can be slow and routinish. Calcaria does not do any new work from a fear of going wrong. She has tremendous anticipations and anxiety, and she wants support. Her intelligence is good, and she is capable of doing this out of routine job, and she will do it if a slight support is given to her. Not so with the Baraita. She is convinced that this is not my job. You ask me any favor for my routine job, I can help you, but don't try to give me a new job. She cannot, she can do it, but after she has been thoroughly trained for it, there is no anticipation like Calcaria, but she is convinced that she just cannot do it. So lean, thin, orthodox people who do not want to change, who rigidly adhere to their orthodoxy and widen the generation gap can also be the Baraita. A very important aspect of understanding that they cannot adapt the new situations and they are very, very adamant and they are having a fixed idea, they can be a Baraita new. So element in the Baryta Mure is the shortness of the stature. You can think of Baryta Cup, the childishness, the Baryta Cup, routine work tendency of the Baryta Cup, and the orthodoxy of the Baryta Cup. But muriaticum element gives rise to the sensitivity of muriaticum. So most sensitive Baryta is Baryta Mure. There is an introvertedness of the muriaticum and anxiety about the futures of the muriaticum. And the other entry point which leads to the Baraita Mure personality is we can start thinking of Baraita Mure when we see the people who have a multiple lymphadenitis. The lymph node appears like a series of the nodes tied on a rope. This is seen and felt especially in the left side of the neck when the hand is passed over it. These glands are firm and hard in consistency. So whenever you can think of multiple lymphadenitis, you can think of Baraita mute. Even in lymphoma, you can think of Baraita mute. Hodgkin's lymphoma or non-Hodgkin's lymphoma. The people who complain of the sudden electric shock like a pain, it is also a Baraita mute. The people who have a tendency to the recurrent hoarse or the husky voice, Baryta Mure. The people have a convulsion because Baryta Mure direct actions on the throat and it affects the chronic affections of the throat. People who have a convulsion that are preceded by the electric shock-like sensation, you can directly think. These are the physical particular symptoms of the Baryta Mure, which can give rise to indications. There is the insanity predominant, and that is of a sexual drive insanity. So the sexual Baryta is Baryta Mure. Mostly the left-sided paralysis with the loss of voice and sensation intact, that is the Baryta Mure. So Baryta Mure, even though all Baryta is right-sided, the Baryta Mure can be a left-sided remedy because of sensitivity. Now, children of the Baryta Mure, so you can think when the thin undergrown children with the thin neck, narrow face, sharp features, who look malnourished and who are always suffering from the chronic cough. They are chilly and thirsty, sometimes hot and thirsty. Amongst friends, these children are always the followers. They can never be a leader. They have one friend whom they always cling to, always following him and imitating him. If that friend hurts him or stops talking to him or quarrel with him, he is bound to fall ill. The children to whom, when the question is asked, are busy in their own world and do not answer our questions as if they were thinking of something else, you can think of Baryta. Miasmatic, the pathological, the active process of psychosis with the excess synthesis of fibrin causes hardness of the gland. The genetic process of the defense used by the Baryta Mure is the genetic code seems to be predominantly the excess fibrin synthesis and the deposition. The fragility within the tissue during the SORA seems to be combined with the reinforcement with the fibrin as compared to the loosening and elastic depletions in the Baryta self. So this is what the miasmatical you can also think that the Baryta Mure is more hard, whereas Baryta self having a looseness and elastic depletions. Thus, the gland become hard in Baryta Mure. The arteries, the wall of the arteries become hard and giving rise to arteriosclerosis and the hypertensions, the tumor formations in major artery giving rise to the aneurysms. So pulsating tumors in abdomen is the Baryta Mure. The elastic blood vessels lose contractility, become hardened and therefore fragile. More the psychosis increase, more the blood vessels harden, and finally they broke and the rupture. So Baryta Mure can go into third defense of the destructive process, and that is the syphilis. Therefore, there can be a paralysis. Similar progress of the syphilis can lead to the destruction of the mental control, and this causes insanity. So, insanity of Baryta Mure is associated with the increased sexual thoughts, as Baryta Mure has excessive sexual desire as compared to the other Barytas. Baryta self, the hot plus thirsty and extroverted Baryta, with all features of the Baryta cough. If the patient is hot in thermal and very mixing and talkative like sulfur, you can directly think of Baryta sulfur. So many a time the Baryta sulfur does not fall directly in the mouth of the homeopath. You are prescribing either Opidia, you are prescribing the hyoscyamus, you are prescribing sulfur, you are prescribing the lachesis, the extroverted remedies, and finally you can understand this is what the extroverted personality is there, but there is something at the intellect level which gives rise to a misplacedness, and then finally you landed with the remedy that is Baryta self. So this is not the first remedy directly comes into your mind that Baryta comes directly. So you have a lot of experience, and then after experience, you can get the easy understanding. So this is what we are installing the knowledge of Pareto in your mind, and so that you can think in this pattern, so that easily you can reach out to this remedy. So a 35 years old patient residing at the hill station was deaf from 3 years of the age. For 32 years, he was using machines for the hearing. This man was known to all in this hill station as a deaf person. Right from 8 years of the age, he was earning money by washing cars that visited these hill stations. He was a total extrovert and made a lot of friends. For days together, he would not take bath nor change clothes. He never thought of changing his job for 27 years. This man was prescribed Baryta Sulf 200 single dose that cured him of his deafness. He threw away the hearing machines and can hear very well for last 3 years. The Baryta Sulf is predominantly the psychotic miasm. This psychosis is hypopsychosis and it is characterized by the loss of elastin being synthesized by the genes. Less of elastin lead to lack of elasticity and looseness is seen everywhere physically and mentally. So less of elasticity in mind lead to the following nature: the loss of will. There is no will to do anything. This is yielding remedy. This makes it very timid remedy. The timidity gives rise to the anxiety and the suspiciousness. Anxiety with no willpower make it play safe. As psychosis becomes stronger and she starts desiring more than she needs in order to cover the anxiety for the future. So there is a rubric: will loss of desire more than she needs and fear of conversations. Word hunting or the forgetfulness while speaking, word just disappear from the mind. This causes a fear of conversations in these people. Physically, less of elastin production gives rise to a weak back, a chronic back problem, or the lumbago is because of the relaxed muscles of the back. When these muscles are under strain, the back pains. Hence, we get the characteristic backache of Baryta self, which is aggravated by sitting erect or the standing erect. So, same way, the standing is the worst position of the sulfur. You can think of back pain aggravated standing erect or sitting erect. You can think of Baryta self. As soon as the patient sits, relax, and the pain go. So the rubric can make it as is the exertions, physical aggravation, the flabby feelings, stabby feelings, hard parting, and relaxation muscles. Relaxations, flabby feelings in the hard part is another characteristic symptoms of the Baryta self. So the entry point of the Baryta self, we can start thinking about the Baryta self when we see the Baryta is tall Baryta with the sulfur-like personality, extroverted, the left-sided Baryta personality. So we see the right-sided chili remedy, timid remedy, bashful remedy, Baryta carb, the hot, introverted remedy, chili remedy, like bashful like the Baryta, and it is a Baryta mure, but here the extroverted, left-sided, and hot and thirsty is Baryta sulf. So ladies who buy too many things when they go for the marketing, there are some, these are the example what sir encounter and sir prescribe this remedy. There are some ladies who out of insecurity as well as the brainlessness will buy 5 kg of vegetable when only 1 kg is required. She will buy everything more than the required quantity. The food, whether it is perishable item like a fruit or a sweet meat, will be purchased in so much quantity that it will be kept in the refrigerator for the days and then throws away as they become stale. For her, there is no definite approximation, no calculations at fault. Further, does not mind buying and growing rather than falling short and risk being laughed at. So this is what very important that उसको फेंकना खरीदना कोई दिक्कत नहीं है पर लोग हंसेंगे ना उसका प्रॉब्लम है so that is what they cannot understand that is the imbecility so sir prescribe this I will show you two video of insta and that represent the Baryta quality at the end of the sessions. The people who are interested in the old historic place, art, creativity like a sulfur, but the Baryta element does not allow them to take interest in the knowing the historic fact, nor does the Baryta element allow her to create or copy any of this art. This means there is only a superficial interest in the historic architect and the art, and there is no depth in the interest. You can think of Baryta self. The generals of the Baryta self is like pulsatilla, the closed room aggravation. Baryta self is like arsenic, midnight aggravation. Baryta self is like a carcinogen, desire for the chocolate. And Baryta self is like sulfur, interest in art and architect, but no aptitude. So whenever you have this kind of personality, you can think of Baryta self. Baryta iode Baryta iode again I had given you idea that when you think of self iode and mute they are hot. So Baryta iode is hot, thirsty, and iodum has one of the element that is the speed, and that speed is the hastiness and restlessness. And again the iodum has and the metabolism is increased. So there is one point we can think of the hunger aggravation. He cannot remain hungry. So this is what a few point indicating the iodum. This is the Baryta with the difference. It has a sharp memory. So Baryta iode is very intellectual memory. It is a sharp memory and is a sensitive Baryta. This is the only Baryta who likes to dream and go into fantasies. Unlike other Baryta, it is not so. It is not so. It is a fast remedy, hurried, restless, and impatient like a tarantula, argentum nitricum, and sulfuric acid. So we have a hurry, impatience, and restless Baryta. You can think of Baryta iode. It has perhaps more representatives of the iodine element like any other iodine salt. It is fast and furious in actions and the temper. So Baryta iode has very hasty speech. It is difficult to understand the speech in one spot. We need to ask him again, I beg your pardons. There are other remedies also having hasty speech like a heparsal, hyoscyamus, lachesis, and mercury, etc. So we all the differentiating it with this heparsal talks fast when it is vexed and angry. So we know that heparsal is angry, impulsive remedy. Hyoscyamus talk hastily when happy, cheerful, and cracking the jokes. So most of the stand-up comedians you can think of the remedy might be Hyoscyamus because of the quickness of the mind and intelligence. Aconite and Lachesis talk fast generally all the time so that only they can get a chance to talk and nobody stop their loquacity. Mercury talk fast to assert its supremacy. Pyrogen talk fast only in the high fever when his heart beats more than 140 per minute. So disproportionate of the cardiac heartbeat with the loquacity and delirious conditions with the fever. You can think of pyrogen. Lachesis also talks hastily in fever to keep up with the rapidity of the thoughts in the brain. Sepia may have a hasty speech with the fast movement of her hand. So these are the few remedy you can think of when there is a hasty speech. Baryta iodum does not appear in the list of the remedy given in the repertory. We have observed it as having a rapid speech. The probable cause is the impatient and hurried nature of this remedy, and the hasty speech comes from the impatience. So impatience causes him to hurry. He is in the hurry to finish off things, and hence his speech becomes fast and hasty. Many a time he is not bothered to get a reply also. He does not mind not being understood. This is in keeping with the Baryta trait. The impatience can increase to such a degree that in syphilitic miasm he rarely sits or sleeps even at night. So this was the case. The patient who was architect by the professions, aged 40, came to us with the long-standing acute lumbago of about 20 years standing and avascular necrosis of the right hip joint. He just could not wait for his number to come inside the cabin and see me. From outside the cabin, he gave a ring inside on my mobile phone to tell me that he has arrived. This was not once, but the 5 times in the 7 minutes that he was waiting outside. Can anyone expect a reminder call every 1.5 minutes? This was not an urgent case, nor was the angry for having to wait. He was not angry at all, but just wanted to ask how much more time it was going to take for the previous patient, who happened to be inside the cabin at that time. When his turn came to come in, he said, I am sorry, I am really very, very sorry, 4 to 5 times. He amply apologized for the disturbing me, saying that it is his bad habit that you just cannot wait in one place and that I should treat it first. He was very, very simple, timid, and down to earth man with no hangs up. His speech was hasty, though he was an experienced architect. He was doing a fixed job for only one builder, and he would earn only when a project of builder came up. He never tried to came up in the life on his own. His plan were always stereotyped, and he never ever tried to innovate. If the builder prospered, he would prosper, and if he did not make any reconstruction, he would be without income. Thus, he was totally dependent on one man for his living, despite having a good qualifications. He never came up in the life and remained clinging to one source. So here was the Baryta who was hot, thirsty, but tremendously fast, hurried, and impatient. He was prescribed Baryta iode that cured him according to the Henry's law of cure. So Baryta iode can be best described as misplaced with the too much impatience. So too much impatience causes him to talk in a fast, talk hasty. He is impatient and always in hurry to throw out everything from his mind as soon as possible. To ring up 5 times in 7 minutes because he cannot really understand how much time has passed since he last rang up. That is a misplace. Time passes too slowly, appear longer. There is one remedy that is Baryta Gap. Baryta brain takes time to decide initially, and that makes this man irresolutions like Pulsatilla. Both are timid, both likes open air, both but Pulsatilla is slow and Baryta iodine is fast. So there is a difference between Baryta iodine and Pulsatilla. So sodic Baryta iode, so these children who came with the inflamed tonsils so many times every month that they finally get enlarged and indurated. So Baryta iode children can be identified by the following signs. The children who have a chubby cheek but thin, bony, restless, fast, non-tiring personality. Children who have excessive appetite and can eat two or more McDonald's burger without relish just for the sake of eating and yet remain thin. Children who fall ill at every exam, this would seems to be due to the anticipation, but we know Baryta does not have any anticipation because it does not have ability to think and care for the future. Then the question is, why does he fall ill? The iodine element has an ailment from mental work. The Baryta carb ailment has a mental exertions aggravate. So amount of the hard work put in before the exam in studying has its toll on him and it reduces his immunity to make him prone to tonsil affections. The children who play in a group but can never become a leader, they are always followers. Intellect here very important aspect that Baryta erosion is an exception to the dull intellect status of the all Barytas. They could be having a very sharp memory. The intelligence is only in recalling what he has read. Thus, the Baryta iodine can score very well in academic school and college, but fail miserably where the street smartness is required. So this is what very important we have to understand. The iodine element makes their mind work faster. In syphilitic Baryta iode, at times the mind goes beyond the realm of reality and to the dream and most of the fantasies. So they goes into fantasies, fancies, and they may get absorbed in the fancies. The only other Baryta who also go into level of exalted fancies is Baryta Carp. So this is what in short about the different sort of Baryta. So we will continue the study of comparative studies of Baryta from tomorrow. I will show you a video, two videos of Insta video. You can understand how the Baryta people present to you by looking into it or by using their intellect. So I am sharing that with you in the See, watch this video and
क्या
hear.
क्या मांगता है? वो चूहा मारने की दवा है, दूध दे रहे हो क्या?
नहीं नहीं, उसके साथ में जो है।
अरे वो बम्बई में बोले तो बस घोटाला हो जाता है। नाम बोल।
सपना।
सपना मैं नहीं बेचता हूँ।
नहीं, हमारा नाम है।
तुम्हारा नाम है? तुम्हारा नाम पूछा था क्या? तेरे का को नाम बताने का? उसका नाम बोल क्या है?
दाल।
अभी दाल का नाम बोल।
हम नहीं जानते जी।
दाल का नाम नहीं मालूम? इसका नाम बता रहे।
मूंग की, मसूर की, उड़द की, चने की।
सब दे दीजिए।
सब
कितना?
2 लीटर।
लीटर? मैं इधर दाल पका के नहीं बेचता, ये को भटियार खाना नहीं है, किलो में मिलती है।
अच्छा 2 किलो दे दीजिए।
2 किलो सब?
जी।
चले 2 किलो बन सब।
हाँ।
और वो भी चाहिए।
वो क्या नाम बोलना?
वो जिसे पराठा बनाते हैं।
पराठा? तो पराठे में से पर निकालो तो क्या बचता है?
आटा।
हाँ, तो उसको आटा बोलते हैं, याद रहेगा। मैंने इधर स्कूल नहीं खोला है।
ये आपकी दालें।
ये भी दे दीजिए।
ये कितना?
2 किलो।
तू हट के सड़, मैं समझता हूँ, तेरे बस की बात नहीं है। ये कितना मांगता है तेरे को?
2 किलो।
2 किलो? ये दूध नहीं, केला है। ये डजन में मिलता है।
अच्छा 2 डजन दे दीजिए।
2 डजन है तो मालूम नहीं कहाँ से आ गए।
और ये भी 2 डजन दे दीजिए।
हाँ जी, 2 डजन।
तू क्या कर रहा है? तू गिर रहा है क्या?
2 डजन।
अबे वो अंगूर है, अंडा नहीं है। माँ वो क्या मिला रे?
ये किलो में मिलता है।
किलो में मिलता है।
अच्छा।
ये किलो में मिलता है, ये लीटर में मिलता है, ये फुकट में मिलता
पैसे
है।
कितने?
See, look at this, how this personality is represented to you with the process that they have shown you, that the persons who are dealing with also become confused of this. So this is what the Baryta people are, and they cannot understand the gravity, they cannot understand, and they having the dull intellect and misplaced things. Another video I am sharing with you, you can think of.
ये कौन सा कप लेके आए हो? बच्चों वाला कप लेके आए हो आप? ये इसमें चाय पीऊंगा मैं, बच्चों वाले कप में शेर बना हुआ है।
सॉरी, मुझे पता नहीं था कहाँ पड़े हैं कप्स।
वहां पे जाओ, वहां पे एक प्लेन कप पड़ा होगा, वो मेरा कप है, उसमें लेके आओ चाय।
ठीक है, सॉरी। ये ले, जल्दी पकड़े, कप बड़ा गर्म है।
आपको किसी ने नहीं सिखाया?
क्या यही कप है ना? देखिए इसके ऊपर कोई फूल शेर कुछ भी नहीं बना हुआ।
अरे चाय ट्रे में लाते हैं, ट्रे में लेके आओ चाय। ऐसे गरम चाय में ऐसे पकड़ के बैठूंगा? कहाँ रखूंगा इसको मैं?
सॉरी 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 सॉरी, प्लीज, मैं अभी लेके आती हूँ।
यार बहुत लेट करती।
सॉरी सॉरी, ये ले, आपने कहा था ना ट्रे में, ये ले आई मैं आपकी चाय। वैसे आप ये ट्रे से ही सुर्क लेंगे या मैं चम्मच ले आऊं?
नहीं 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 नहीं, और कुछ नहीं करना, बस मैं सुर्की लूंगा।
So look at this, how the Baryta, this was the video made by persons, but this is what how the persons, Baryta persons can be. So this is for our basic understanding, and many a time you can understand at the gravity of situations that something you can think in patient also. So whenever the patient comes to you and the relative told you something that ये ऐसा ही है सर, इसको समझ नहीं आता, so something you can, so this is something you are thinking when you are dealing with the Baryta people. So they have a misplaced things, they have a dull intellect, they have a head belongs to other, they cannot understand the gravity of situations, and they follow, they are the followers. So the in second video, when husband is asking that plain cup में लेके आओ तो plain cup लेके आए, उसने बोला कि tray में लेके आओ तो tray में लेके आए, so that means they have not used their intelligence. Okay, so this is something you have to think in the patients when you are dealing with the Baryta personality. Hope you enjoy these videos along with the learnings. So thank you so much for the sessions, and we will learn along with the fun. Thank you all. We will conclude these sessions today. Thank you. Thank you all.